National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hey there, Dr. Jonathan Beatty, naturopathic doctor and a health expert here at Nationalnutrition.ca. Today I want to talk to you a little bit about Candida. Now, Candida, there's actually multiple species of this yeast. It's typically the most common cause of vaginal yeast infections, but it doesn't stop there. It is actually a very common cause of an intestinal infection as well. I've even seen statistics showing up to 11% of surgical wounds can actually be infected by Candida. There's a couple of different types. The most common is Candida albicans. However, there's also Candida Glabrata and Candida Tropicalis. So, it's not always the Candida albicans that we have to worry about. There are a few species that can negatively impact human health. So how do we develop it? Well, Candida is a yeast and it typically likes inflamed tissue. It likes places that are dark, it likes places that are warm, moist, and don't have a lot of oxygen. And for that reason, it typically will infect the vaginal canal, or it'll infect the human intestine. Men can get it generally as well, although it typically isn't symptomatic. And so they basically tend to behave as carriers. So if you do get recurrent vaginal yeast infections, one of the things to make sure is get your partner to get tested, because it could actually be them transmitting the condition to you repeatedly if it keeps coming back. There's a couple different ways we can look at treating it. One of the most important factors in treating any type of yeast infection is diet. The reason for that is yeast are what are called fermenters. They like to ferment sugar. Anybody who's made homemade wine or beer knows that yeast is one of the most important parts. And basically what you do is you take yeast, you take sugar, you combine the two, and over time the yeast is going to digest that sugar into alcohol or ethanol. And if you leave it too long, what ends up happening though is your wine becomes vinegar, and you've done too much fermentation, you've over fermented it, and you produce acetic acid and actually another toxin called acetaldehyde. Now this is where Candida becomes problematic, because Candida in the intestine can be fermenting your food into acetaldehyde, which is actually liver toxic and neurotoxic, which is what creates a lot of the symptoms. The symptoms of Candida are varied. There's so many different ways it affects people, and it typically changes based on where the acetaldehyde is acting in the human body. One of the easiest ways to detect Candida is easy bloating. If you eat a high carbohydrate meal, and you eat the small bun and it feels like you ate that whole loaf of bread because everything swells up, well, that's fermentation at its finest. One of the side products of fermentation is gas production, okay? Eating a small piece of carbohydrate, this small, it should not expand unless there's gas. And that's what creates, especially bloating after meals. There's often an imbalance in the gut bacteria, and typically one of the most common causes, although it's not always Candida, but one of the most common causes is an infection or an infestation with Candida, either albicans or some of the other species. So one of the things we want to do to manage it is, of course, you don't take your enemy out to dinner before you go to war with them. And so what you want to do is reduce the food sources to the Candida. So I typically look at reducing the intake of refined carbohydrates or easily fermented carbohydrates. I also look at the reduction in the intake of legumes. The reason behind this is there's a few sugars found within legumes that are difficult for humans to digest, but easy for yeast to digest. This is where we get the old schoolyard rhyme, beans are good for your heart. The more you eat, the more you pass gas. That is based on fermentation of those sugars that are difficult to digest. For that reason, I typically will reduce refined carbohydrate intake, and I will reduce intake of any type of legumes. I also recommend reducing any type of food that you react to, because what's happening is it's creating inflammation within the gut, and it's that inflammation which is where the yeast wants to live, where the Candida wants to set up shop. So you want to reduce its habitat. Reduce the amount of inflammation in the gut and you can reduce the habitat. One of the other things to help prevent getting this, take a probiotic. Probiotics basically help inoculate your gut. Instead of having a yeast colonizing your gut, you're colonizing yourself with healthy bacteria, and they outcompete the yeast and prevent it from being able to take root. This is why when you take antibiotics, one of the major side effects you can get is the development of a yeast infection. The reason for that is you're killing the good and the bad bacteria, but you're not doing anything to harm the yeast. And that nasty little bug Candida sets up shop because there's nobody there to prevent it from setting up a big colony. And then once it sets up shop, that's when you'll start to get recurrent symptoms of a Candida infection. Treatment of Candida, different species are resistant to different types of antifungals. So I typically recommend using a combination therapy. I'll usually use a herb called Pau D'arco or Taheebo. Its Latin name is Tahebuia impetiginusa. I'll often combine that with some black walnut, which is Juglans nigra. I'll combine that with some grapefruit seed extract, Citrus paradisi. There's a couple of different things that you can use to help manage and remove the Candida and kill the Candida. A few other antifungals, oregano oil, olive leaf, Goldenseal. They've all been shown in studies to be able to help control that Candida infestation. And then of course, re-inoculating yourself. Even if you're taking a natural or a herbal antibiotic or antifungal, you're still going to want to re-inoculate yourself with that beneficial bacteria. And so I usually recommend a combination of bacterial probiotic as well as a specific yeast probiotic that's Candida's arch nemesis. This yeast is called Saccharomyces Boulardii, and there's plenty of research showing that Saccharomyces Boulardii gets in there and it actually produces a chemical called a candidicin, which kills the Candida, removes the Candida from the system, and so basically you're outcompeting it. So you're using antifungal herbs, antifungal probiotics, and then re-inoculating yourself with a healthy blend of bacteria, inoculate the gut to prevent the Candida from being able to grow itself back. So those are some easy management tips that you can use to help manage your chronic yeast infections, be they vaginal or intestinal. And if you're not sure, you can go to your doctor and get tested for these things. There's blood markers. You can actually test for antibodies against the infection or do cultures of the suspected tissue if you think you have a topical yeast infection. So make sure you get properly diagnosed. Use combination therapy to treat. Make sure you're always re-inoculating yourself with the healthy bacteria. And those are some helpful tips to manage chronic Candida. So if you like this video, please check out more of our natural health videos, subscribe, and if you have any questions or comments, please post them below. And always remember, knowledge is health.